Hi, hello everyone. Welcome back to Women's and Children's again. So, for those of you who don't know me, I am Aimee Wiltshire. I'm I'm an O&G consultant. I work here at Women's and Children's and out in private. And I am speaking initially on behalf of our group and welcome you to the 22nd consecutive year and the 12th to be titled the annual Dr. Brian Pridmore Perinatal Forum. In the first instance, we'd like to acknowledge this land that we meet on today is the traditional lands for the Kaurna people, and that we respect their spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region, and that their cultural and heritage beliefs are still as important to the living Kaurna people today. So you will have noticed we've returned to our previous location. We've had 2 years running the forum through the Napier Building Lecture Theatre at the University of Adelaide. And one of the main reasons we came back here was because of your feedback, which is very vital and really helps us determine what we talk about, where we talk about it, and you know, we really appreciate completion of the feedback forms. So we do want to keep this function going, and the ability of that to be kept going does depend on the number of hits. So please encourage anyone who's not here tonight and is keen to check it out, just let them know it is available. And I have put up this slide, which I do every year, via the SA Health website, which is where we can go for perinatal practice guidelines and the like. And you can look back and see all our talks from the last few years on there. And as I was saying earlier, essentially every second year I have a parasite, so here we go again. Now, before I actually get into the recommendations of the Maternal and Perinatal Mortality Committee, we've had a few changes to our committee this year, and so I just wanted to flag that with everyone. We farewelled some of our stalwarts last year, and we've got some fresh faces who've come along to help us bring this to you tonight. And so we're very happy to welcome Dr. Tracy Bradbury, registered midwife Kirsty Roberts, registered midwife Kim Parker-Gray, and registered midwife Anita Older. And this is in addition to all our ongoing members, so chaired by Dr. Morgan Vatani here, Dr. Vanish Bhatia, who I have spotted at the back there, who's always there for us, Dr. Ken Wangahu as well, and then all gloriously pulled together for the first time this year by Sam Powell, with great thank you. And a great job bringing it all together. So each year, as part of this forum, we do like to bring to your attention the latest recommendations that will appear in the annual report. And these are the provisional draft recommendations that have come out. The first maternal subcommittee recommendation is that consultation with an obstetric provider should be sought for any woman presenting with hypertension and or headache in the 2 weeks following birth. And the second is pregnant women who contact the hospital with atypical abdominal pain and or repeatedly with complaints of worsening abdominal pain should be assessed in person and not by telephone. Right, so they were the two main recommendations that came out. So on to this year's forum. We've encouraged, as we have for the last few years, encouraged our speakers to incorporate clinical cases if they're able to, and we sometimes puts the topic of discussion into context. And so generally we'll start that. Our fantastic experts who very kindly volunteered their time tonight will present for about 20 minutes each, and then we'll have time for questions at the end. And that's the time we've always encouraged audience participation, and so we will have microphones going around that we'll be bringing along, and so please wait for them, partly because we of course want to film it all and put it on the website afterwards, as long as everyone is happy. So why have we decided to talk about diabetes in pregnancy? It's always highly requested. It's probably one of the most commonly requested topics on the feedback forms every year. We have discussed it in the past, but we know it is very prevalent in our population, both gestational but also the long-term forms, and then has an impact upon our day-to-day management of our obstetric population as a result. And so we thought we'd discuss it again tonight, particularly because the guidelines and screening they've undergone a few changes over recent years as well. and so prompts us to relook at diabetes and its effect on pregnancy, and vice versa.